Afternoon, everybody. My name is Darren Smith, and today we'll be going over the muscles of the lower leg. And here we have a breakdown of the different compartments in the lower leg. We have our superficial posterior compartment, our deep posterior compartment, we have our anterior compartment, and lateral compartment. So let's begin in the superficial posterior compartment with our gastrocnemius. So this muscle is innervated by the tibial nerve. It's also biarticular because it crosses the knee joint as well as the ankle joint. And its actions include knee flexion, which is moving the heel closer to the hip, and plantar flexion, which is pointing those toes down towards the ground. Next, if we remove our gastrocnemius, and also we have a lateral view here showing the lateral head of the gastrocnemius. And we have the medial view showing the medial head. Again, medial head, lateral head. Next, we have the soleus, which is going to be innervated by the tibial nerve. Its action, this one is called a uniarticular muscle because it only crosses one joint. Its action is going to be plantar flexion, pointing those toes down towards the ground. Next, we have our plantaris. Now, some people actually don't have a plantaris, and this is innervated by the tibial nerve, and it again is biarticular, and it helps with knee flexion, the heel towards the hips, and plantar flexion, toes down towards the ground. We move from the superficial posterior compartment to the deep posterior compartment with the tibialis posterior, and I'll let you guess whether it's uniarticular or biarticular. So now, its actions is ankle inversion, which is moving that medial aspect of the foot upwards, or the big toe side of the foot upwards, and plantar flexion, which is pointing toes down to the ground. Again, you can see it here. Next, we have our flexor digitorum longus. Now, this is innervated by the tibial nerve. Its action is plantar flexion and toe flexion of digits 2, 3, 4, and 5. And you can see it here, medial to the larger tibialis posterior. Next, we have our flexor holocus longus. It's also innervated by the tibial nerve, and it's going to be lateral to our tibialis posterior, and its action is going to be plantar flexion, toes to the ground, and toe flexion of just the big toe. And you can see here, you can guess what muscle this is. I'll give you 2 seconds. 1, 2. This is going to be our flexor digitorum longus, and you see it has the tendons going to digits 2, 3, 4, and 5. And then here we have our flexor holocus longus. Also, another way to remember these muscles are the order in which their tendons pass behind the medial malleolus. We have the tibialis anterior first, which is going to be Tom. We have our flexor digitorum longus, which is going to be Dick. And then the next one is going to be our flexor holocus longus, which is going to be Harry. Then we go into the anterior compartment now. We have our tibialis anterior here. It's innervated by the deep peroneal nerve, and its actions is ankle inversion. Remember that medial side of the foot, bring that upwards, and dorsiflexion. Those toes bring it towards the shin or the tibia. Next, we have our extensor digitorum longus. Now, this is, you heard that digitorum longus term before, again with the webbed structure, but this time it's an extensor, meaning it's in the front of the foot, versus the flexors, which are in the back of the leg, front of the foot, the front of the leg, versus the flexors, which are in the back of the leg. And it's innervated by the deep peroneal nerve, and its actions are dorsiflexion and extension of digits 2, 3, 4, and 5. And then, since we have a digitorum longus, we have a holocus longus as well, but extensor holocus longus. It's innervated by the deep peroneal nerve and acts on the big toe for extension of the big toe and also dorsiflexion of the ankle. Next, we have our Peroneus tertius right here. It's innervated by the deep peroneal nerve. It assisting dorsiflexion, as well as ankle eversion, which is bringing that pinky toe side of the foot or the lateral aspect of the foot is going to be bringing that upwards into eversion. Now above the peroneus tertius, we have our peroneus brevis. Now this is going to be innervated by the superficial peroneal nerve. And its actions are going to be plantar flexion and ankle eversion. Now above the peroneus brevis, we have our Peroneus Longus. And its action is going to be plantar flexion, toes to the ground, and ankle eversion, pinky side of the foot or lateral aspect upwards. Its innervation is going to be our superficial peroneal nerve. Interestingly, if you look, this is our Peroneus Longus, and it starts on the lateral side of the foot and moves all the way onto the medial aspect of the foot. So when it pulls and that rope pulls, it's going to really bring the foot into extension. So it's a great example of how structure dictates function. Back to our beginning slide. So use as needed, and wish you guys the best of luck moving forward.